the fifth speaker is the Chris Beach, come from United Kingdom. Yeah, today, Chris gave us that the topic is acupuncture of peripheral neuropathy as a complication of chemotherapy in cancer patients. So let me introduce that Chris. Mr. Chris Beach, he got the bachelor degree of science. He registered physiotherapist and acupuncturist in the UK. He joined a neuro rehabilitation center in Buckinghamshire, where he currently works as a neuro acupuncturist. Chris specializes in multiple sclerosis. He also attends a clinic providing both physical therapy and neuroacupuncture at South Buckers Hospice. At there, he treats many cancer-related symptoms resulting from chemo and radiotherapy. He has been trained in acupuncture in 1986 at the Center for Alternative Medicine in Southampton. So warmly welcome, Chris. You can start your speech.
Thank you very much, Dr. Nee, and nice to be invited to speak to everyone today. And thank you to all the previous presenters. I've been so interested in so many wonderful presentations. I only hope I can give you some interest in my few words that I have today. I have to say that Dr. Wang previously stole much of my fire talking about peripheral neuropathy, but as you can see there, so I've taken out some of my slides, so I won't be quite as long, but I'm hoping to give you a little background as to my involvement and how I've tried to help people with peripheral neuropathy as a complication of chemotherapy in the treatment of cancer. So my scope today, I'm going to give you a little bit of background, a little more in a moment, talk about my basic assessments, and then look at the treatment strategy, which is quite straightforward. And I only have 1 or 2 case studies. I don't have to go into 8 or so case studies. And then I'll just summarize for you. So here we have a couple of pictures, really just giving you a bit of background on the Chiltern MS Centre, where I hold a neuroacupuncture clinic. And for many of you that are involved in treating multiple sclerosis, it's quite a challenging disease because it presents with so many different symptoms. But acupuncture, I find, really helps, particularly with bladder symptoms, bladder irritability, and fatigue and emotional issues. And that leads to help with sleep. So you can see here from the pictures, is a wonderful building built in 2012. We have a hydrotherapy pool, Pilates gymnasium, and numerous treatment facilities. That's at the MS Centre, where I work for a couple of days a week. And then I too have had a problem. There we go. And this is the other clinic where I work at the South Bucks Hospice, not too far away in High Wycombe. And this is where I treat basically people that are in end stage cancer care, palliative care, and try and help them with all of the problems that you can have with cancer treatments, emotional, the effects of chemotherapy, fatigue, pain, endocrine disorders, and musculoskeletal dysfunction. I see all the different types of cancer, head and neck, brain tumors, lung cancer, all the secondaries that you can see in the spine and the bones and the joints. And so I get challenged regularly to try and help people that are going through the various stages of cancer. In particular, and that's what I'd want to talk about today, is chemo-induced peripheral neuropathy, which is between 10 and 20% of people that are going through chemotherapy. And I'm going to talk a little more about that now. So, chemo-induced peripheral neuropathy. I'm just going to move something out of the way. There we go. As I've said, it occurs in 10 to 20% of people that are undergoing neurotoxic chemotherapy. And there is little wonder when you consider that the chemicals that are pumped into our bodies, if we're diagnosed with a cancer, are toxic. And there is little wonder that that toxicity does not just do damage to, for example, our hair cells where we lose our hair, but also all the other cells around our body, because that toxicity is traveling throughout the body. And so for our peripheral nerves, whether it's the nerves themselves, the ascending, descending tracts within the spinal cord, or within the centers of the brain, it's not surprising that they can insult those nerve endings, those nerves, those neurons, and with patients ending up with problems in their hands or their feet and or in their spine. It's another area that is involved. And so it affects the sensory and the autonomic nervous system. And of course, in the traditional Chinese medicine pathogenesis, it's related to the inequality to direct qi and blood to the extremities, also associated in blood. I'm unable to go back. Ah, yes, I am down there, sorry. Yang and kidney deficiencies. I'm sorry, my screen is not, that's bad.
Okay.
I keep losing my screen, I'm sorry. Acupuncture has been described as a moderately effective form of treatment in ATCM, but I'd like to describe two case studies where I feel I've been able to influence positively with people that are experiencing chemo-induced peripheral neuropathy. So the treatment rationale, I think it's really important to conduct an assessment of the patient before you start treatment, looking at location, intensity, duration, looking at what provokes, what eases it, mapping out a pain map, looking at the pain specifically. Is it spontaneous? Is it provoked by stimulus? Is it a burning? Is it an intermittent shooting, electric shock-like? Is it stimulus dependent? Is it worse with heat? Chemical stimulation, for example, cream on the hand or water, such as pressure or bed sheets, or the feeling of certain types of materials, or as I say, water against the skin. And there are so many different types because, of course, we have so many different nerve endings in the skin. They can all be provoked or specific. Chemo-induced neuropathy is varied, with no two patients the same. And I've found this time and time again. They all describe it slightly differently. Glove and sock symptoms, so on the hands with the glove and on the feet with socks, those are quite typical for them to describe the sole of the feet, or just in the palms, or just the fingertips, or just the toes. And often it varies types and levels of intensity and the sensation, often easing as treatment reduces. And what I mean by that, when patients are undertaking and going through chemotherapy, as they go back to see their oncologist, they can explain that they have these symptoms and they're getting worse. And the oncologist can actually titrate and change the medication to reduce those effects. Obviously, they want to gain the maximum effect targeting the cancerous cells, but at the same time, they don't want to make life unbearable for the patient. So that feedback is really important. So just a few tips during assessment. Comparing body parts is important, and comparing non-painful with painful parts. Ideally, it's contralateral equivalent. So if they've got pain in the right hand, usually it's both, but if they have, you can get them unilaterally, then compare the good side first. So compare the good side. So they know what's coming. They know what to expect. And then work from the non-painful side, or work from the non-painful area into the painful area, so that they know what's normal and they know what to expect. And then you can map out any region for comparison and draw a little map or whatever, and they can describe to you what they feel as you're feeling over the skin. So most likely causes, as you can see here, the platinum-based drugs, these are usually the most common medications that will cause this peripheral neuropathy. And those three on the top there, I found are the usual cause. As you move down the list here, these are less likely. And so examples of targeted cancer drugs causing nerve damage include bortezomib, also known as Velcade, and also thalidomide. However, hormone therapies and biphosphates are very unlikely to cause nerve damage, which is nice to know. And of course, hormone therapies are becoming more and more popular. They're becoming more and more specific. They can target specific cells, specific cancerous cells. So I'm finding that more and more patients are being put on the hormone therapy, particularly towards the end of the other platinum-based drugs, and they're on those for a longer period of time. So my treatment rationale, I have specialized in microsystem acupuncture, and today I'm really going to focus on JO's technique for scalp acupuncture, which was recognized in the World Health Organization recognized report of 1991, and those are the two case studies that I'm going to talk about today using JO's technique of scalp acupuncture. Now, these are slides from the World Health Organization report. These are the recognized lines, and I'll just highlight now the two main lines that I tend to use are line 6, the motor area, and line 7, which is the sensory area. And these are two really powerful lines that I found. And of course, if I move across to this one on the right, these lines are divided into fifths, and the upper fifth on either are down for the spine and the lower limbs. And the middle 2/5 are for the upper limbs, and the lower 2/5 are for the face and that area. And you can see those lines there. There are two additional lines which are run parallel, 3.5 centimeters down, just level with Governor Vessel 20. And I use those from Dr. Wang and for the foot motor and sensory, which is not shown in this diagram. So before I go into the case study, I'll just talk about the outcome measures that I use. I tend to use MIMOP2. I've tried numerous types of outcome measure. It's always nice to get feedback from your patients as to how they feel. And I know in many occasions it's subjective, but it's nice to have that feedback and a system that they know and understand. So the MIMOP measure is a patient perceived change in symptoms and severity. What I like about it, it's got a well-being and an activity or an ability to undertake an activity score, because not only do they have symptoms, usually 1, 2, or 3 symptoms, they have an activity usually that they can't do that they would like to do. And then there's a well-being score as well, which I quite like. And the well-being score, of course, it is multifactorial. And these measures are combined to provide a profile which helps to provide that quantifiable change. So you've got a before and an after, which I quite like. So this is the first case study, and this is a 59-year-old male, stage 4 prostate cancer, who, following excision and 3 rounds of chemo, came to me and was complaining of problems on bilateral soles of his feet, and it felt as though it's burning. And you can see here, I've got here on the left side, symptom 1 intensity, and on the first session, it was 6 out of 6. So they're all scored out of 6. So that was 6 out of 6. The activity, and that was his main symptom. So I only chose one of the symptoms. I had an option to choose 2 or 3, and we just chose the one. That was the issue. And then the activity, and his activity, used to enjoy, before treatment, used to enjoy going for a walk in the morning, but he could only manage at the moment half a mile, and actually couldn't manage that when he first started. He was in so much discomfort, and he scored 6 out of 6 on the first session. His well-being score was 5 out of 6 because he was really quite depressed with the pain and the problem that he had, and also the fact that he couldn't do the activity that he really enjoyed. I think he actually used to go for a daily walk to pick up his paper in the morning, and he just couldn't go for that walk. So my treatments initially started with some scalp points, so governor vessel 20, the line 7 sensory, and that was bilateral, upper 1/5, targeting the lower limbs, foot motor and sensory, which I mentioned earlier, and I used electroacupuncture 2 to 80 hertz with a course stimulation. For the first treatment, just 15 minutes. And you can see there I used a combination of rectangular and high amplitude waves for the electroacupuncture. Well, that was session 1. And then for session 2, I repeated that. And because of his emotion, he did say to me that he was feeling quite emotional and he was struggling sleeping. I added 2 more points in, which were emotional points, which Dr. Wang, in his text, I put that as a reference at the bottom there, he highlights. And actually the feedback following the first session was very good, because his symptom 1 was down to 4. This is after the first session. And his ability to walk, he couldn't walk the half mile still, but he felt he was able to walk further around the house and in the garden. And his well-being score had dropped to 4, which was good. Of course, 0 is on top of the world, 6 is awful. And as you can see here with I moved back to the next slide. I've moved it forward. As you can see here with session 3, again, it was the same score, but I kept repeating that. I increased the treatment period to 45 minutes. And then for session 4, 5, and 6, you can see here how there's been a nice steady reduction. And he's still under care at the moment. And he's had 6 sessions. And I'm very pleased to say that his symptoms have reduced. He's now able to walk his half mile. He's still got some discomfort, but he's coping with that. And his well-being score has dropped to 3. So he's actually quite pleased with the way things are going. And we haven't stopped. We've got some more treatments to do. So I'm hoping that will come down even further. So my next case is a 64-year-old lady who is in stage 3 breast cancer. She had a lumpectomy followed by 4 rounds of chemotherapy and a series of radiotherapy. And as you can see here, I've used the same MIMOP outcome score. She was complaining of bilateral paresthesia in the hands and the fingers. It's mainly on the palms of the hands and into the fingertips. Now, her hobby is needle stitch, and she was doing this all the time. She'd retired at 60, and she's spent most of the last 4 years enjoying needle stitch and spending time with her grandchildren. And as you can see, her score when she came for her symptom was 6 out of 6. Her activity for needle stitch was 6 because she couldn't do it at all. She couldn't do that activity at all. She just couldn't tolerate fine implements in her hand, and she couldn't stitch at all. She couldn't hold, she couldn't thread a needle. She was quite upset by all of that. And so treatment, similar to the previous patient, governor vessel 20, line 7 for sensory, and I used the bilaterally upper 1/5. And then in addition to that, I used line 6 for motor. And for that, I used the middle 2/5 for the upper limbs. And I used foot motor and sensory also. And I added in emotional and spirit points. I tried electroacupuncture, but this lady would just not tolerate it. She just, for some reason, I don't know why, she just couldn't tolerate stimulation with the electroacupuncture. So I used manual stimulation, and as we're recommended, up to 200 rotations a minute. I don't know, I'm that quick, but I did stimulate frequently as fast as I could to get that stimulation. And as you can see here, very similar story. We were able to bring her scores down to from 6 out of 6 for all of those 3 measures, down to 3 for her main symptom, down to 2 for her ability to needle stitch, because actually after the fourth session, she was down to 4. She could actually hold a needle, she could thread the needle, and it was improving all the time. And of course her well-being, because she was now active, she was now doing what she really enjoys and loves. So she was starting to feel much better. She has now gone back onto more chemotherapy, and she's not coming in for treatment at the moment. But before she left and started a further round of chemo, she was very pleased, and I was also very pleased that we were able to help. So those were my 2 case studies, and in summary, I'd like to just say that chemotherapy-induced peripheral neuropathy can present with different symptoms, often on both sides bilaterally. Scalp acupuncture can be used as an effective treatment, often positively affecting the quality of life for people under treatment for cancer. And whilst you can see with those 2 case studies, I wasn't able to eradicate completely their problems, I was able to help them to try and improve on their quality of life. And if you reflect back to my earlier slide, one of our key issues at the hospice is to try and impact on people's quality of life. And I feel with these 2 patients, I've been able to do that. Thank you.
Hi, thank you to Mr. Chris Smith for your wonderful sharing. Yeah, you use scalp acupuncture for peripheral neuropathy. It's very interesting. So thank you. Yeah, thank you. Yeah, for good presentation.
Thank you.
Thank you very much. Yeah, we learn a lot. Yeah, knowledge from you. Yeah, very good presentation. Okay.